Hi everyone, my name is Heidi Avery and I am going to be speaking about rhabdoid tumors today. So what are rhabdoid tumors? Rhabdoid tumors are an incredibly aggressive type of malignant tumor that are typically seen in younger children or infants with peak incidence between 1 and 4 years of age. And the average age at presentation is about 11 months. These tumors typically develop in the brain or kidneys, but can be outside of the central nervous system or renal system. Some abbreviations I'm going to be using, if these tumors are inside of the central nervous system, they're called atypical teratoids, rhabdoid tumors, or ATRT. If they're in the kidneys, they're called rhabdoid tumors of the kidney, which is RTK. If they're in soft tissue, they're called extrarenal RT or malignant RT, which is MRT. And these may present in more than one site, so they're not just limited to one spot. There's no race predilection for this. And these are slightly more frequent in males with a 1.37 to 1 ratio. In infants, these account for 18% of renal tumors, 14% of soft tissue tumors, and 9% of liver tumors. And like I said, this is incredibly rare, so only about 58 people per year are diagnosed with this tumor. What causes rhabdoid tumors? So you have a gene in your body called the SMARCB1 gene. This is a member of the SWI-SNF chromatin remodeling complex. It's a gene involved in tumor suppression, and whenever you have a rhabdoid tumor, this gene is not being expressed. This can be due to somatic de novo mutations that occur spontaneously, which is the majority of the cases. And another reason could be germline mutations or deletions of this gene. The majority of the germline mutations are from homozygous inactivations of the gene, and about 25 to 30% of patients have germline mutations. Something a little bit unique about this is that deletions are more common on the paternal allele and mutations are more common on the maternal allele. Because this occurs in such young patients, these are passed down from an unaffected parent, usually who does not know that they have this mutation. The first mutations reported were somatic renal and extrarenal mutations, and then germline and somatic mutations were found in the brain, kidney, and soft tissues. The events that incite these genetic alterations are really unknown, and they're unsure why they happen. And there's no environmental or infectious associations associated with rhabdoid tumors. Some more about the SMARCB1 gene. Approximately 24% of ATRTs and 40% of RTKs and 70% of MRTs have homozygous deletions of the entire locus. So both alleles are gone and the gene is just completely gone. It's not expressed at all. It's not there. Partial deletions make up about 15% of these tumors. And although this is the predominant gene involved in rhabdoid tumors, about 2 to 3% of patients retain expression of this gene and have somatic mutations or germline mutations in the SMARCA4 gene instead. Over here, this chart, this was a study done of about 200 sporadic rhabdoid tumor patients, and they found, like you can see over here, it's a little bit confusing to read. So this was not the germline mutations, but you can see about 15% of patients had partial deletions, like it says over here, and then about 40% had the had the entire deletion of the gene. So diagnosis of this is pretty similar to other types of cancer. Usually a biopsy or tissue sample will be done, and they'll test for mutations in the SMARCB1 gene. This goes also by the name of the IN11SNF5 or the BAF47 gene, but the nomenclature we use is the SMARCB1 gene. They can also use computerized tomography scans or CT scans, magnetic resonance imaging, MRIs, abdominal ultrasonographies, positron emission tomography, which are PET scans. They can also use laboratory studies kind of as a starter to see where if they need to go from. In these laboratory studies, about 55% of patients have hemoglobin levels less than 9 grams per deciliter. They also can detect microscopic hematuria in about 75% of patients, and hypercalcemia is present in 25% of patients. Some signs and symptoms, because patients with rhabdoid tumors are so young, pain is really difficult to assess. Like I said, the average age at presentation is about 11 months. And since they can't really communicate, it's difficult to know kind of what the issue is or if there is an issue. Patients with rhabdoid tumors of the kidney usually have signs and symptoms related to intrarenal masses, and there is gross hematuria present in about 60% of patients. There's a fever present in about 50% of patients, and synchronous or metachronous central nervous system lesions in about 20% of patients. Because this is such a rare and aggressive form of cancer, unlike other forms of cancer, there's no set standard of care. Usually surgery is the very first step, and they'll remove the entire kidney or the part of the kidney, and they really are just trying to remove the entire tumor if possible. Chemotherapy is usually used after surgery, and they'll do a very aggressive course of it. If you didn't know, chemotherapy interferes with the cancer cell's ability to grow, and they use often a combination of different chemotherapy drugs. Radiation can also be used in children over 6 months old, and stem cell transplants are another form of treatment they use because the treatment is so intense. It often affects blood and immune cells. So they will remove healthy blood cells, go with a really intense radiation and chemo to overwhelm the tumor, and then they're given back the healthy blood and stem cells to promote normal organ function. Also, clinical trials are really encouraged if you have rhabdoid tumor cancer, because this is such a rare form of cancer, and there's not much known about it. So the prognosis of kids with rhabdoid tumors, it's not great. The overall 5-year survival rate is only about 23.2%. It's a rapidly progressive tumor, and most deaths occur within 12 months. The most common sites of metastasis at presentation are in the lungs, abdominal lymph nodes, liver, brain, and sometimes the bone. Some age outcomes, from 0 to 5 months, only 8.8% of patients survive. 6 to 11 months, 17.2%. 12 to 23 months, 28.6%. At 24 months, 41.1% of patients survive. Some different stage outcomes. Stage 1, this was a study done with different patients at different stages, and they found that with stage 1, 33.3% of those patients survived. At stage 2, 46.9%. Stage 3 was 21.8%, and stage 4 was 8.4%. And in this particular study, at stage 5, 0% of the patients survive. So you can kind of see over here the age outcomes. It correlates a little bit with the older you are, the better chance of survival you have. But because these kids are so young, chance of survival is not great. So here's my references. Thank you all so much for listening. Sorry it was so sad. And I hope you learned something.